and get started. So my name is Rachel Sample. I'm with CHIP. I am representing the group that has been getting together, if you will, to update the winter contingency plan for this year. We have a number of partners involved with the plan pretty directly. In particular, obviously, Wheeler Mission, who does the coordination of intake for the winter contingency, and other folks that we list in the plan as partners, such as Horizon House and the Street Outreach, Animal Rescue, Homeless Initiative Program, lots of other folks. And so if you need a copy of the new plan for this year, it is now on the website. And that link here I will put in the chat right away so you can follow along if you'd like to as we are going. And there we are. And you can do that. I also have a PowerPoint presentation. So I'm going to go ahead and share my screen. Hopefully that will be viewable to you all here in just a second. Oh, of course it does that. Okay.
Do I need to make a host or anything?
Nope, I just have to pick the right screen to share. There we go. There we are. You don't all need to look at yourselves. If I share my one screen, then you'd all be looking at your own faces. Is anybody having trouble seeing the screen? Okay, so all right, we are there. That's great. So like I said, I'm representing a number of partners here today. I do want to just let folks know that we do have Mary Beth on, and I saw Colleen hop on from Wheeler as well. Everyone send warm wishes to William Bumpus. He is, I believe, at the airport right now. So he's taking a well-deserved little trip, I think, heading out this morning. So William did say that if anyone has questions, they're welcome to reach out to him. His email address is in the plan, and so is Mary Beth's. But again, we can drop those into the chat feature if that's more helpful for people. We're happy to answer some questions, as many as we can today. But if something comes up and we're not quite sure, we want to make sure we get that over to William so he can address it. All right, so obviously we know that winter contingency is going to need to look different this year. And as we look at how winter contingency is going to look different, let's see if I can advance my slides. It might just work like this. All right. As we look at how winter contingency is going to look different, we first just want to recognize that we will be starting on November 1st with our winter contingency, just as we normally do. And we will also continue to utilize Wheeler Mission as the coordinating agency for intakes. So if you have really anything related to intake and operations, as far as like a question about where to send people, things like that, we're going to address that today. But Wheeler will be your contact for those types of questions. We have spent a great deal of time looking at how we can take precautions to reduce congregate sheltering during winter contingency this year. HUD actually released some new guidance on winter contingency sheltering. So that just actually came out this week. So we're trying to integrate as many of those new ideas that are applicable in our community. What I am pleased to say is that when I went through that plan, the proposed items that HUD was suggesting, we really addressed many of those already. So I think it just goes to show that the partners we have involved with winter contingency really have a lot of expertise in this area and have really thought through things pretty substantially in order for us to address almost any circumstance you can kind of think of that's likely to come up. For clarity, I just want to clarify that the city of Indianapolis has a separate cold weather emergency plan for warming sites. I have been in touch with the folks at OPHS, that portion of the department that addresses the emergency sheltering, day centers and things like that for warming locations, if there were to be some sort of extreme temperature event. And that type of event, for those of you who aren't familiar, that's when the city would, for example, like declare some sort of emergency state. So it's not something that exists all the time. And therefore, it really is a separate plan that the OPHS maintains and manages every year. I was in touch with them. They are updating that plan and they'll be releasing it. And I'm sure we will push it out as soon as we hear from them if there are any updates and changes that they'll be making, as we always do every year. So be on the lookout for that. But it is a separate plan, so questions related to warming sites and things like that would be best addressed to those folks. And again, if you need contact information for that department, that's also in the winter contingency plan for us, just as for sake of convenience as a partner. So just to let you know what we're going to cover today, I hope that folks, after we are done today, will know where individuals need to arrive for intake. I think that's one of the most important things. You need to know where to send people when they need to come in. We want to make sure everyone understands the difference between single men and family single women overflow intake, because there are some differences from past years, in particular with women and families. You will hopefully know where to go to get a copy of the plan, and then we're going to address as many questions as we can. So want to be mindful of time. I know I can speak quickly, so I will be keeping track of questions in the chat, and if you need me to slow down, Chelsea, I'm looking at your face, so you can just signal me. All right, let's first go to single men, because I know that's usually where we have most questions. As I said earlier, Wheeler Shelter for Men, here forward referred to as the SFM in the plan and in this document, is coordinating shelter and overflow. And for that, just as they always do, we're going to suggest that all single men arrive at the shelter for men. So if you have individuals over 18 who need winter sheltering, then they are men, identified as male, they should arrive at the shelter for men. Wheeler will then transport men to overflow sites. So as with past years, they will be sheltering individuals at the shelter for men, at the men's residential center, and at a new location that we are calling the hotel overflow shelter. And it really will operate as an overflow site. So the shelter for men will be continuing to utilize their current shelter capacity and then utilizing the overflow. The shelter capacity obviously has decreased with COVID-19. So you'll see here on this page and in the plan that typically the shelter for men would be sheltering up to 400 men. And this year they'll be sheltering 200 men. Typically the men's residential center would shelter 90 men, and this year they're sheltering 60 men. And then we will have hotel overflow to assist 100 men. And that site will be used as an overflow location. As far as who will be assigned to stay at the hotel, William and I spoke at length about this to get clarity. And I think the most important thing to know is that first, if a gentleman is assigned to the shelter for men and stays there, he'll go back to the shelter for men. If Wheeler transports him to the hotel location, he does not need to return to the shelter for men daily for his intake, if you will. The intention is that once someone's at the hotel, they're going to stay there. And so they will be making sure that people have transportation to get there the first time and getting people out there. They just will be doing meals out there. They will have access to hygiene items. They obviously will have their own rooms, so showers. They've arranged for laundry to be done there. So rooms will have clean sheets, towels, clothing, things like that will be addressed. The shelter for men staffing will actually exist in the overflow site. So there will be staffing there, case management there. There will be folks there full-time to address the needs of the people in that overflow location. The main other thing to know is that if somebody leaves the hotel for more than 24 hours, so if they've got a job, absolutely going to and from work is not an issue. If they have schooling of some type or training, that's not an issue. But if a gentleman leaves and is gone for 24 hours, then we're going to ask him to go back to the shelter for men to do an intake again and start there. We can't guarantee a spot for anyone at the overflow site. It's, as you can imagine, this is very different operating this type of location as opposed to an in and out kind of environment as a typical emergency shelter would be. And for capacity and management of staff and staffing, we really are going to be asking that folks, stay at that hotel location, remain at that hotel location obviously with COVID-19, take appropriate precautions to not congregate, to wear face masks, all of those things that we would be asking people to do. And so having folks, you know, continue to go long-term there is what we expect at the hotel, as opposed to maybe the more in and out environment of the typical shelter. So kind of as far as procedure and policy goes, just understand this is, we've never really done it this way before, so I'm sure there will be some hiccups, but I've spent a lot of time talking with Wheeler staff and William, and understanding that they, as they are every year, there to work with people, make sure people are safe, to get your feedback about someone you have concerns about, just as they always do, and make sure that everyone has a safe place to stay warm and survive the winter. So just know that that's really the intent of everybody involved at the Shelter for Men and Shelter for Women and Children as well. So I'm going to move on to the next section on women and families, but I do want to make sure that I loop back around to any questions that you might have about Shelter for Men. So don't worry, we'll get to those when we wrap up. All right, so for women and families, single women and families, the Wheeler Center for Women, also called CWC, is again going to be coordinating the hotel shelter for women and families. And please know that this is the one big change. They will actually be located at their hotel. So starting next week, and Mary Beth is on, who's the director there, she and her team will be doing intakes out of that hotel location. The hotel is listed with the address in the winter contingency plan, and it's going to be a big change from previous years. So we're very excited and appreciate them essentially picking up and moving their operations to a new location. The existing CWC will still be utilized for sheltering, but there won't be using any gym floor or mat space or anything like that at the CWC. We are, and so if for some reason somebody ends up getting assigned to CWC, they'll go from the hotel to CWC, they'll transport them. So again, similar to the Shelter for Men, you know, Wheeler is addressing the transportation issue to make sure people get where they need to go. The hotel overflow capacity is 175 rooms. That's obviously a lot of rooms. Understanding that family makeup and family size may impact the number of true households we have. You know, if we've got a household of 7 people with 2 adults, that may need to be split between 2 rooms. So I don't want to necessarily speak to how many families we can hold right at this time, but obviously in most cases, for most families, we're likely to have a capacity of 175 because we have that number of rooms. Again, similar to Shelter for Men, case management will be on site. Meals, laundry, and hygiene items will be available. And the shelter staff are coordinating I'm working with them to get them all in touch with the McKinney-Vento liaisons. Mary Beth and I are working on that this week, so that children have transportation from school. I've already spoken with the state McKinney-Vento liaison, so she is aware as well. So we're gonna really be able to touch probably all of the schools in Marion County that we would be interacting with, not only through the existing contacts we have, but through the state office. So we feel very appreciative, like I said, to both men and Center for Women and Children, in that we are able to pick up operations and move them to these extra sites. There's obviously a big capacity lift for both sites, and we really just thank you guys so much, and wish you all the luck as we get kicked off here. So a couple of notes and important things to know about what's occurring at both sites. And I should highlight this actually previously. So because of the flexibility we'll have through the hotel location and the private rooms and things like that, the CWC will be having families with children, regardless of age or gender, sheltered together at the hotel. So if there's a situation where typically we would be asking a young person to maybe shelter separately from their family, or a man separate from his partner and children, or a single gentleman with children, all of those will be allowed together at the hotel overflow site. So that is a big change in comparison to a typical sheltering that we are working with in a typical women's shelter environment, because they have that capacity for private rooms and all sorts of other things. So I just want to make note of that. That is a change. And Mary Beth can answer specific questions about family makeup and structure. She and I were going through lots of scenarios this week, and I think we've thought of pretty much everything, and they'll all be available there at the Center for Women and Children. Now, just for clarification, if it is a couple without children, they would still ask that couple to shelter in 2 separate locations. So that would be the preference, since there aren't children in the household. So that is the one caveat. And Mary Beth, please correct me if I'm wrong, but I believe that was one of the scenarios we went through in email, and that's your guys' preference there. But if there are children in the household, then we would absolutely be keeping family together at the hotel.
Rachel, do you want questions now or at the end?
I may get to some of these before we get done, because I have 2 more slides. Maybe.
Okay.
Yeah. So I do just want to add a couple other things. We will possibly be utilizing Central Christian Church as an additional overflow location, again with reduced capacity. William is still speaking with the church about whether or not this is something we're going to need, but it would obviously be a significantly smaller number of people at that congregate location than what we typically see. And we will be updating the plan accordingly and pushing that information out to all of our partners if that development does happen. As of right now, it's not finalized, but if we want to use it, we have the variance in order to do so. So we have no legal hurdles to jump through in order to do it. It's just a matter of whether or not we believe it'll be necessary or safe. So those are kind of the things we're kind of thinking through there. So a reminder there that the non-congregate shelter will be operating during winter contingency. It's not the same as the overflow hotel, and we are not treating them as the same thing. Folks who are at high risk for COVID-19, the priority will still be to get them to the non-congregate site. And also that we will be prepared to shelter them safely in the meantime prior to them getting to the non-congregate site. So William has assured me that, obviously anyone would be able to come in. They will address their shelter needs and make sure they're sheltered safely given their risk for COVID and all of those types of things. And then we'd like to get them over to the non-congregate site, because that site's really designed for that population. The services that are there are really supporting those folks with medical conditions and high-risk needs and all sorts of things. So just making sure that's clear, because obviously they're both in hotels, and this is a little bit a lot different in many ways. If you are referring somebody to the site, the plans continues to suggest that you go ahead and call ahead, just so you're aware of kind of what you're coming into. They may have information to share with you about who knows what's happening that day or what's happening, but it wouldn't necessarily be to turn anyone away, but because we see all of you as referral partners. If you're bringing someone in, go ahead and call ahead and let the team know, just capacity and all that. I think they appreciate it. People can still walk in. If they come in on their own, that's totally fine. But if you're bringing somebody, we always just encourage folks to give them a ring first. And then if there are questions or concerns about an individual person's needs for sheltering, this is obviously stuff you guys do year-round with folks in shelter to make sure that the shelter staff know and are getting to know the person you're bringing to them. So, of course, continue to talk to Wheeler staff about questions or concerns. They're obviously very open to understanding and listening to what somebody might be needing. So just for some additional considerations, service animals, so somebody who has like an official service animal, not somebody who says they have a support animal, but this is a service animal, those will be acceptable. Other pets will likely be supported by SOAR in most situations. I have reached out to Angela. I don't know if Angela's on the call today. Hi, if she is. But you know, they have been a wonderful partner for Winter Contingency over many years, and we anticipate that continuing this year. For clarification, in the past, we have utilized HIP for additional hotel funding. That money will not be available this year. So if you are looking for hotel stays or things like that, that won't be available through HIP. So you'll want to utilize the winter contingency overflow locations in those situations. Horizon House has day shelter for single adults, and Outreach Inc. has day shelter for youth and young adults, for places for folks to go during the day. The information that's listed in the plan currently for Horizon House is what we are providing. Obviously, if we have COVID-19 flare up, if there's a situation, these hours may be adjusted, staffing may be adjusted at any of the supporting agencies. So just be on the lookout for communications coming out. Continue to attend these types of calls where people provide updates about what's happening at their agency all the time. But as of right now, what's in the plan is what's expected to be pretty standard, barring unforeseen circumstances at this time. William and Mary Beth's email addresses are in the plan. William is also working with his colleague Darius Gover, to answer questions as well, and his phone number's in the plan. So when things come up as we start to implement this, don't hesitate to reach out. And just know that, you know, we are appreciating everybody's patience with this, not only patience in waiting for this plan to be ready, but also in being understanding that things are going to look different this year, and everybody's doing the best that they can to make folks safe. We may have hiccups along the way, but I know that folks, their ears and their eyes are open to hearing from people and making sure that we are fixing things that may go wrong as we proceed with any of our sheltering this winter. So I'm going to go ahead and stop my screen share so I can see comments and questions. So I apologize if you were looking at any of that, but again, this will all be on the website.
So Rachel, can I jump in with our first hiccup?
Yeah, go ahead.
So first of all, we are very excited about this year and the ability to serve differently and have some expanded services. But in true winter contingency fashion, we have our first hiccup heading into it, in that we do not yet, or better said, the city does not yet have a signed contract with the hotel. So we fully expect that to happen, but it has not happened yet. And it may very well not happen by the 1st. That does not stop us from doing services on the 1st for women and families, but that does mean that we will be starting services at the Center for Women and Children if there is not a signed contract. So that would mean typical winter contingency rules, a narrower definition of families, all that kind of stuff that would have been typical in the past. And the intake site would, of course, be the Center for Women and Children. So there's no way, we were told by Matt that we would know by noon on Friday, one way or another, at least how the weekend is going to go, since it does start on Sunday. So I think we'll just say depend on, perhaps, I don't know, Chelsea and Rachel, I'm looking at you, email and website to provide clarification.
Yeah, absolutely.
Honestly, for November 1st, it's probably easiest to just tell everyone to come to the center, and then we'll figure it out from there. That way, regardless of where we are actually having to make it happen, they have a spot to go that we can take from there.
All right. Thank you so much for that clarification, Colleen. And I hope that all gets addressed ASAP so you all can get kicking off with this. So yeah, we'll go ahead and update that and make sure that that's reflected in the plan for right now. So as Colleen was saying, please go to CWC until further notice. But we hope that will be for just a short period of time.
Yep, and as soon as we hear official word that contracts are ready, we will push that out as quickly as possible, just so, again, November 1st is a Sunday, just so everyone kind of knows going into the weekend. And I know, right, we were on a call yesterday afternoon with the city team and the health department, I know everyone's working towards that November 1st launch. So, you know, already talking about, you know, things that needed to happen on Sunday in terms of food and things like that. So I think everyone's still pushing for that November 1st. So as soon as that confirmation comes out, we'll confirm with everyone. Other questions that came through chat, and Colleen's been a rock star kind of answering questions.
Yes, I saw that. Thank you, Colleen.
And I think, Colleen, you got most of the questions just in real time as they were coming in. I think Kay did ask a quick question about clarifying access to the family overflow. Kay, was that answered yet? About accessing the overflow for families?
Hey, Chelsea, this is Andrew from the city. Do you guys need anything from me before I jump off?
Do you have any updates on signed contracts?
We met with Extended Stay last night in the evening, and I think we've worked through everything. Both hotels should have their changes to us by midday Friday for final approval.
Okay, perfect, Andrew. That sounds consistent with what Colleen just said too, that looking at midday Friday for final confirmations.
Yeah.
Okay, and I know you can't see chat because you're driving, but Colleen just said that you've been a rock star through all of this, so thank you.
Yes, thank you, Andrew.
Oh, thanks to everybody that's helped out with this.
Awesome. So yeah, I think we are good, and we'll just kind of touch base with you and Matt by Friday and get word out to everyone that November 1st is a go.
Yeah, that sounds good. We will let you guys know as soon as we can.
All right. Thanks so much, Andrew.
Thanks.
Thank you. Bye.
Bye.
Well, I will, if there's no other questions, I'll turn off the recording and we can proceed with your normal Thursday call, Chelsea. Any other questions? Oh, yeah, Mary Beth.
Clarify one thing. I just wanted to clarify. Hi, everyone. I'm Mary Beth Wheeler. I just want to clarify that if you have, it's really not a bad idea just to make sure you call us before you drop anyone off, because everything is changing, and this way we can make sure that we're on the same page. So all our contact information is there. So just make that your first stop.
Thank you. Thank you. Absolutely.
So get to know Mary Beth really, really well. And William, right?
Yeah, and Darius too. Yeah, they're yeah, great team.
Awesome. So
All
no
right.
other questions? All right. Well, I mean, thank you all so much for continuing to work on this to make sure that there are safe and healthy options this year for individuals and families of all sorts and kinds and makeups. It is really exciting that these options are going to be available. And we'll continue using these calls for any kind of updates that come through winter contingency, so everyone knows how to access and refer folks, so that everyone realizes there are really safe, healthy options. And as Rachel said, just to reiterate, the non-congregate that has been operating will continue through the winter months. So high-risk individuals, continue please referring. The quarantine and isolation site will still stay running. And we'll hear more from the AIC next week from Jim and Brandy, but the Rubin Engagement Center will continue operating as well, even though there may be a move to a new location. So there'll be more information on that too.
Thanks, everybody.